Did you know that certain very common medications could damage your kidneys? Yes, it is true. While these medications provide quick relief and play a very important role in managing your health conditions, the improper use of them can have dangerous consequences for your kidney health. So, in today's video, let's explore 7 common medications that can damage your kidneys and learn how to use them correctly. At the end of this video, we will also answer some frequently asked questions about this topic. So, let's begin. Number 1. Antibiotics. The first class of drugs that can badly affect your kidneys is antibiotics. Yes, you heard it right. Most of us consider antibiotics as very normal and have taken them at many points in our lives. In fact, antibiotics are the most prescribed medications to treat different types of bacterial conditions. Among them, the popular antibiotics are amoxicillin, ciprofloxacin, augmentin, penicillin, clindamycin, nafcillin, azithromycin, levofloxacin, metronidazole, cephalexin, and Bactrim. Nearly all of these antibiotics work in 2 ways. They either kill the bacteria or they prevent bacteria from multiplying. However, what you don't know actually is that antibiotics can badly harm your kidneys. They have more adverse effects, especially when you take them improperly or you use them for an extended time period. Keep in mind that your kidneys play a very important role in filtering out the waste products from your body. These waste products include medications too. But some antibiotics, like aminoglycosides and vancomycin, can accumulate in your kidneys. And they can cause direct damage to your kidney cells, which results in cell death. Even if you use them correctly, certain antibiotics can increase the risk of your permanent kidney damage. According to a report from the Centers for Disease Control and Prevention, CDC, about 1/3 of all antibiotic prescriptions in the United States are unnecessary. They are not appropriate for the condition being treated. This overuse of antibiotics not only contributes to antibiotic resistance, but also puts unnecessary strain on your kidneys. So, the next time your doctor prescribes you antibiotics, make sure to ask whether they are truly necessary. And if they are not, just avoid them and prevent your kidneys from being damaged. Number 2. Nonsteroidal anti-inflammatory drugs. You might not be familiar with the specific term anti-inflammatory drugs or NSAIDs, but you must be familiar with the popular over-the-counter drugs like ibuprofen or Advil, aspirin and naproxen or Aleve. All of these drugs are actually NSAIDs. They are widely used to relieve pain, reduce inflammation, and lower the fever. While NSAIDs are literally lifesavers when it comes to managing the severe conditions of pain and inflammation, they can also cause serious damage to your kidneys. They basically work by blocking an enzyme called cyclooxygenase or COX. This enzyme is responsible for producing substances that can cause pain and inflammation. But this enzyme also plays an important protective role in your kidneys. And when it is blocked, then the blood flow reduces to your kidneys. This thing can lead you to a condition called acute kidney injury, or AKI. In fact, NSAIDs are one of the most common causes of kidney injuries caused by drugs, and this risk is even higher in older adults, people with pre-existing kidney issues, or those who are dehydrated. Long-term use of NSAIDs can lead to chronic kidney disease and, in severe cases, kidney failure. So, if you are dependent on NSAIDs for pain relief, especially if you use them on a regular basis, then talk to your doctor about the safer alternatives. Number 3. Diuretics. The third risky drug for your kidneys is diuretics. They are also known as the water pills. Diuretics are usually used to treat some conditions like high blood pressure, heart failure, and swelling caused by excessive fluid retention. These drugs actually increase the amount of urine your kidneys produce, and this thing then helps in the removal of excessive salt and water from your body. Some common diuretics are hydrochlorothiazide, furosemide, Lasix, and spironolactone. While diuretics can be very good for managing your fluid retention and can help in lowering your blood pressure, still, they can cause severe damage to your kidneys. One of the main reasons for that is dehydration. Remember that when you lose too much fluid through urine, then it can lead to dehydration. This dehydration puts additional strain on your kidneys, and it can lead to acute kidney injury. Diuretics also create imbalances in electrolytes like sodium and potassium. When these imbalances become severe, then they can also lead to permanently damaging your kidneys. So if you are taking diuretics, make sure to keep yourself well hydrated and regularly monitor your kidney function. Reach out to your doctor as soon as possible if you note any signs of dehydration, such as extreme thirst, dizziness, or reduced urine output in your body. Number 4. Proton pump inhibitors, or PPIs. These medications are used to treat acid-related conditions like gastroesophageal reflux disease, or GERD, and stomach ulcers. Some common PPIs include omeprazole or Prilosec, esomeprazole or Nexium, and lansoprazole or Prevacid. PPIs reduce the amount of acid produced in the stomach and hence provide you relief from some symptoms like heartburn. While PPIs can be very effective, still they can cause kidney damage, especially if you use them for the long term. One of the main damages they cause is acute interstitial nephritis. This is a type of kidney inflammation. It can lead to reduced kidney function, and in severe cases, it can cause your kidneys to fail. A famous study suggests that long-term PPI use is associated with an increased risk of chronic kidney disease and acute kidney injury. So, if you are using PPIs for your acid reflux or other stomach issues, use them in the shortest time possible. And stop using them as soon as you feel better. Number 5. Angiotensin-converting enzyme, or ACE inhibitors. Angiotensin-converting enzyme, or ACE inhibitors, such as lisinopril, enalapril, and ramipril, are commonly prescribed to treat high blood pressure, heart failure, and kidney disease. These medications work by relaxing your blood vessels, lowering your blood pressure, and improving blood flow. For people with kidney disease, this improved blood flow can protect the kidneys over time by reducing the strain on them and lowering protein levels in the urine, which is a common issue in chronic kidney conditions. However, while ACE inhibitors have protective benefits, they are not without risks. One of their major side effects is a potential decrease in kidney function, especially in people who are dehydrated or have other health conditions like heart failure. This is because ACE inhibitors reduce the pressure within the kidneys, which can sometimes cause a drop in the estimated glomerular filtration rate, a measure of kidney function. Although this slight reduction is generally not harmful and indicates that the kidneys are relaxing, in some cases, it can become more severe and lead to acute kidney injury. The risk of AKI increases when ACE inhibitors are combined with other medications like NSAIDs and diuretics, as these combinations can reduce blood flow to the kidneys even further. Additionally, when there is insufficient fluid intake or dehydration, ACE inhibitors can exacerbate the risk of kidney injury. To minimize these risks, it's important to stay well hydrated, and if you are taking ACE inhibitors and have concerns about your kidney health, consult your doctor about ways to lower your risk of complications. Number 6. Antiviral drugs. The next class is antiviral drugs. These are medications that are used to treat viral infections like the flu, herpes, hepatitis, and HIV. Some common antiviral drugs are acyclovir, oseltamivir, and tenofovir. These common antiviral drugs can have adverse effects on your kidneys. It is because they can cause direct toxicity to your kidneys. Some of them can lead to a condition called acute tubular necrosis, where the cells in the kidney's filtering tubes are damaged or destroyed. This can result in reduced kidney function or even kidney failure. Some antiviral drugs can cause kidney damage by forming crystals in the kidneys. These crystals can block the kidney's filtering system, which causes kidney stones or acute kidney injury. This is especially a concern with drugs like acyclovir and indinavir. So, if you're taking antiviral medications, then you should be extremely careful about your kidneys. Number 7. Lithium. Lithium is a common medication used for mood stabilizing and certain mental illnesses like mania and bipolar disorder. Some common brand names of lithium are Priadel, Camcolit, Lisconum, and LI Liquid. While lithium helps in calming the mood, it has adverse impacts on your kidneys too. If you use lithium for a long term, then it can lead to very serious kidney issues. It can cause both acute and chronic kidney disease, as well as kidney cysts. Furthermore, lithium can make your kidneys excrete more sodium than normal. This is a condition known as sudden hyponatremia. In it, the sodium levels drop quickly in less than 48 hours. It can be life-threatening, causing muscle breakdown called rhabdomyolysis, severe confusion, seizures, coma, and even death. So, you should be cautious while taking lithium. You must maintain a regular diet with enough salt and fluids with it. And there you have it, 7 medications that destroy kidneys. Now let's answer some of your frequently asked questions. Number 1. Which drug is highly toxic to the kidneys? NSAIDs are generally highly toxic to kidneys. They can cause permanent damage to your kidneys. Number 2. Which type of medicine is harmful to the kidney? Medicines like antibiotics, NSAIDs, antivirals, and ACE inhibitors are very harmful to the kidneys. Number 3. What medications cause kidney damage? Nonsteroidal anti-inflammatory drugs, PPIs, diuretics, and lithium can cause kidney damage. Number 4. Which antibiotics damage kidneys? Antibiotics like ciprofloxacin, augmentin, azithromycin, levofloxacin, metronidazole, and cephalexin damage the kidneys. Number 5. What medication causes kidney injury? Medications that can cause kidney injury include certain antibiotics, nonsteroidal anti-inflammatory drugs, some blood pressure medications, diuretics, and chemotherapy drugs. Thanks for watching. If you found this content helpful, please like our video and subscribe to our channel for more informative content.